If you've been following the rescue page, you might know that recently Rocky was given some not so great news. He was diagnosed with large cell intestinal lymphoma. And there was a lot of up and down about how we were going to go about his situation given his certain circumstances, as well as how we diagnosed it. But now that we are a few months in, I wanted to tell you guys all about it. So let me forewarn you, there's going to be a lot of big words in here. Let's break it down. Originally, given Rocky's specific case, we were not going to move forward with any sort of chemotherapy. But I'm going to tell you why we changed our mind and moved forward with the CHOP protocol. Now I'm going to start talking faster because there's a whole lot to say. First, why were we originally not going to move forward with any sort of chemotherapy? There were a couple different factors that we took into account specifically due to Rocky and his circumstances. Number one, Rocky is FIV positive, and not that that can be a big detriment on their life, but in these circumstances, it does weaken their immune system and can play a role in his ability to heal. Now, chemotherapy also weakens the immune system. And another thing that Rocky has never been able to entirely get rid of is a bacteria called mycoplasma. This can cause chronic respiratory issues that can flare up when the immune system is weakened. Rocky also hates taking oral medication so much so that he will hide all day long after he's gotten it. And I didn't want that to be what consisted of his final days. And also, we don't know how old Rocky is. He could be a lot older than we're thinking, which is about 9. So it was just looking like the negatives would outweigh the positive in any time that we might buy him. Despite that being the decision that ourselves and his primary team were leaning towards, we wanted to have all the information we possibly could before making that decision. So let me tell you about the diagnostic steps that we took and the CHOP chemotherapy protocol. First, how did we diagnose it? Well, I'm a paranoid bitch, and I want you guys to know that his story is atypical, and I don't want you to worry. Rocky has really been asymptomatic other than the fact that he started throwing up some bile once a day as it was getting hotter, and he was grooming himself more as he shed. Now, this can be a sign if this bile is discolored or concerning, but it's typically alongside other symptoms. And his bile was clear as day, a flawless spit up. But after about a week straight, we realized that Rocky was due for his annual exam anyway, and so we brought him in out of precaution because we stay on top of his care given the fact that he already has the FIV. His exam went beautifully, his blood work came back great, and Rocky was cleared, but like I said, I am a paranoid bitch. And it dawned on me that our practice's ultrasound technician was moving out of the country at the end of the month. This is where I have no science or logic. I just can tell you that I was hell-bent on getting him that ultrasound before he left. And that's when Rocky was given 3 to 4 weeks to live. Given the size of the mass that was found and its placement, it was not operable. So at that point, we didn't even have a confirmed diagnosis of what kind of cancer this might be. And unfortunately, our oncology around here is typically booked 6 weeks out. And while we held on to that appointment just in case, we scheduled him in the meantime with our internist. So 2 weeks later, we were at that appointment and everyone was just absolutely blown away that this cat was still completely asymptomatic. And at that appointment, we were able to actually aspirate it and get the confirmed diagnosis of large cell lymphoma. And at that point, we were still really hesitant about starting any sort of treatment, especially given how large the size of the tumor already was upon discovery. But we still held on to this oncology appointment, which would land us 3 weeks after his expected expiration. And I just figured that whatever may happen was what was supposed to be. But 6 weeks later, we make it to his oncology appointment and he is still completely asymptomatic. Guys, this is wild. This is not normal, okay? And when we got there, my first sign that this was the right step forward was just how happy Rocky was to be there. He is not a fan of the vet typically, as per a lot of kitties, but for whatever reason, he adored this staff. Now, a big reason I wanted an oncologist's opinion is because I wanted to know her experience with treating FIV positive cats. And to my surprise, she's treated many so successfully that you wouldn't have even known they were positive at all. One 7-year-old even lived an additional 7 years. In fact, we were a little bit more worried about how it might flare up the mycoplasma. Now, it's important to understand that chemotherapy in cats is not exactly the same as that in humans. While it can weaken the immune system, that's typically the only side effect that you may or may not see. And we were only worried because of Rocky's predisposed issues to begin with. Now, factoring in Rocky's emotional response to taking oral medication, we were thrilled to find out that this was only something that he had to take once or every other week. He would have to come in for these treatments, but he loved everyone there and was having the time of his life. Now, there are also still daily medications that are done at home alongside this. The 2 most common are going to be prednisolone, which is an anti-inflammatory, and Cerenia, which helps with symptoms of nausea, either from the chemotherapy itself or the cancer. But thankfully, I was able to have these compounded into tiny little treats that I'm able to plop right on top of his meal and he eats it right up. So the worry of all the stress that we would be putting him through all started to subside. Based on lengthy discussions with all of his doctors, we decided to move forward with CHOP. Now, it's important to know that our goal here is not to cure Rocky, but rather to utilize these treatments to improve his health and quality of life for as long as we can. And as long as it's not at his detriment, we're going to do that. So CHOP, or the Wisconsin-Madison protocol. This includes a multitude of different chemotherapy drugs: cyclophosphamide, doxorubicin, vincristine, and prednisolone. Now, we alternate between these different medications every week for the first 8 weeks. Now, they all have their own routes of administration and also their own potential side effects, so it's important to discuss those specifically with your veterinarian. It's also important to recheck their CBC or complete blood counts weekly while on this medication. Close monitoring is one of the biggest components of all different cancer treatment methods. There are many different treatment options, and although we chose CHOP based on our oncologist's recommendation, as well as all of the successful studies we are reading, you also have to figure out what is best for you and your pet, especially when this experience can be quite frightening financially. We're all just doing our best, okay? Vibes. And really, the absolute priority should be their comfort. Rocky will undergo this treatment each week for 8 weeks, and then every other week for the following 4 months. And we will be watching diligently for any reason that we maybe should stop. But as of right now, we are 1 month in, and I am astounded by his response. Rocky is still completely asymptomatic, and his energy levels have skyrocketed. So as long as this is what's right for him, we're gonna keep moving forward. And thank you guys for allowing us to learn more about this protocol and to provide it to Rocky when he needed it. You are my rock star, Rocky.